Welcome to Ahara Arogya Adhyatma, the light of Samskara. Today we have Dr. Arun Kumar M. He did his MD Pediatrics from Delhi University and then he did his fellowship in Pediatric Endocrinology from Rishikesh All India Institute of Medical Science. And after that, he worked for some time in All India Institute Medical Science, Delhi, and also Lady Hardinge Hospital Medical College. And now he's working in Mysore Medical College, and he's a very popular pediatric endocrinologist. And he's right now in Chalvamba Hospital, and people can utilize his expertise and advice for that. So today we are going to discuss about what is puberty. Doctor, please tell us what is this puberty and when it starts, and is there any difference between boys and the girls? Because as a child, the children, we can't make out whether it's a boy or girl. We ask, what is your name? Are you a girl or a boy? But then, once they grow up, you can easily make out the difference. So what the difference makes, please tell us what is this puberty is.
Hello, madam. Puberty is a stage, it is a link between the childhood and adulthood. It is a phase where a child grows into an adult man or an adult woman. So it is a bridge between these two phases.
Like a transition, you can say, like a transition.
Yes, this is a transitional phase where there will be a lot of changes which will be happening in terms of physical, in terms of sexual characters, in terms of both mental and physical. So there will be a lot of changes which will be happening in this phase. So this is the puberty where there are changes which makes a small child into an adult grown person.
Okay. At what age it starts and what are the changes they occur? Please let us know.
As a God's gift or a nature's gift, this puberty will happen at a specific period. Like in girls between 8 years to 13 years and in boys between 9 to 14 years. Till this age, body waits so that the child should grow completely in the physical form. He should gain his height, he should gain his weight, there should be some amount of mental stability, there should be some amount of mental growth so that the child can understand these changes. So that's why at specific age, these things will start.
How exactly it happens? What changes have to occur? Who controls that, and who is the one who is triggering all these changes?
Yes, as we all know, for most of the process in the body, brain is the master organ.
Yes.
So in the brain, there is a part called as hypothalamus. Hypothalamus will have a switch for puberty. That switch will be off till the time the child reaches 8 to 9 years. Like in case of girls, yes, and in case of boys, it is 9 years. Once the child reaches the optimal growth, optimal weight, and optimal height, the brain gets to know this is the time the switch should be on. So the hypothalamic switch of puberty will switch on at that specific age, and the hypothalamus sends signal to the pituitary gland. Pituitary gland is also there just beneath the brain. It is called as master gland. It's a master endocrine gland which controls most of the hormonal functions in the body. It produces FSH and LH.
Like how we have a master control room, in the same way, this also, even for the switches and the lights, we have the master switch. So this is the master switch.
So it gets signal from the hypothalamus and it will produce hormones from there. And those hormones, the stimulatory hormone, will come and stimulate the gonads. Gonads, in case of boys, it will be testis, and in case of females, it is the ovary. The testis, once gets stimulated, they produce testosterone, which cause the changes in the boys. Similarly, in girls, the estrogen which will be produced from the ovary, it will produce the specific changes which are related.
So the ovaries are producing the hormones in girls, and the testis is producing the testosterone in the boys. So the testis for the boys and the ovaries for the girls are very important. Okay.
Yes. So once these hormones start producing, there will be a lot of physical and mental changes which will happen. These whole changes are conclusively or collectively called as puberty. So what are these changes? So let's discuss about the physical changes. So the physical change will be different in boys and it will be different in girls. So let's take up girls. In girls, once the brain switches on, that it has to produce signals, the pituitary will stimulate the ovary will start producing estrogen. Once the estrogen starts coming at the age of 8 to 13 years in any girl, first it will stimulate the breast. There will be enlargement of the breast. That is the first sign of puberty in girls. So as the breast starts growing, along with that, there will be some amount of pubic hairs and axillary hairs. And along with that, the child start growing height. She will gain height. And also the child, over a period of time, once the breast starts growing, there will be stages of breast development, we call it as. So once the breast start growing, from the time of start of growth, approximately by 2 to 2.5 years, the child will get her first periods also, which we call it as menarche.
Menarche. Okay,
Yes.
okay.
So this is the process of changes, the physical changes.
So for the girls, we have the menarche, but what about the boys? Do they have anything like that or no?
No, in boys, it's a study process. So in boys, in a girl, if for example, as an endocrinologist, when I ask any female, I ask what was your age of menarche, they will exactly remember the age. If you ask the boy, it is very difficult.
They won't know. They won't know. Yeah.
Because there are no specific changes, they will be a transitional and a continuous process. So in both, what we see is there is an increase in the size of the testes, because once the brain stimulates and it will produce the hormones, the testes will increase in size. So once the testes will increase in size, there is an increase in the penile length as well. After that, they will get pubic hairs and axillary hairs. There is increase in the height as well, and there is a change in the voice.
And
also.
the voice also, it becomes harsh and then manly voice. Yes.
The manly voice and the manly body, that all the muscles will start growing, and they will stand in front of the mirror and they will show their biceps. Yes, I'm growing some muscle. It's all the effect.
And in the olden days, even boys used to sing for the ladies' voice, but now men are also singing with the ladies' voice, and the ladies are singing with the man's voice. But in a true sense, the voice definitely changes between the two. Yeah.
It's a hormonal change always.
Yeah. Now, apart from the physical, what are the mental changes that occur? Because, as a child, the child is very, very obedient and dependent on the parents. And suddenly they come to the puberty, they start feeling that they are grown up and they don't have to listen to the parents, and they start rebelling and they start giving back. And, there is some amount of garshan, or the conflict between the parents and the children. And what is the cause for that?
Yeah, this is all true. Like the physical changes, the parents know it, that the physical changes are happening. But there are some mental changes which are under the influence of these hormones. Like the child will feel lonely. Sometimes he will feel sad. Sometimes he'll feel excited. It is same for both boys and girls. So these are all under the influence of the hormone. And sometimes the children, as you said, that they will become a rebel and they will start having friction with parents. They will have difference of opinion with the parents, and they will start reverting towards the parents that these opinions, they have a different of opinion.
Yes.
And also sometimes they will have deeper relationships. In childhood, they will all play with every child, everyone. But as they enter into puberty, they will have a deeper relationship. And along with that, they will have self-consciousness, like they will know how they should look, how should be their appearance, how they should produce themselves in a society. So they will have that self-consciousness.
And not only how to look, they start spending more time in front of the mirror.
Yes.
Until then, the parents will be decorating and making them ready. And now they start themselves spending more time in front of the mirror. Okay.
So they have those changes. So the problem with these mental changes is parents know about the physical changes, they will accept it because everyone has passed through this phase of puberty.
Yes.
But
yes.
changes, they will change according to the scenario and according to the era. Like if you take back to some 30, 40 years back, most of the children, even during puberty, they were afraid of talking to their parents, especially to
yes. No, even after grown up, they were always very obedient. But nowadays, that is not there. Yes.
Nowadays, that is not there, and children are open-minded now. They are very much, they know the knowledge of the society. They know so many things. So what happens is they will have that feel of reverting back to parents, that they will have back answers to the parents. This the parents will not tolerate, because till now, till
Yes.
8 years, 9 years, child was completely obedient, listening to completely the father and mother, whatever they say. They never used to say no to their words. So all of a sudden, if the child does this, it will become a matter of concern for parents. Sometimes they
Yes.
think like the child is outgrowing our hands, he is outgrowing our.
Yeah. Maybe in a bad company, and it has
Yeah.
become a bad, yeah. And they start, and in fact, that is a reality too. Because many times when they are in the puberty, they get into the bad habits, bad company, and they go in the bad direction. Because though physically they have grown up, mentally they don't have that right or wrong decision making. And as a result, neither their child nor they are grown up. So here the parents have to be very careful. What suggestion do you give to the parents?
They're like a new swimmers. Like if
Hmm.
you take a professional swimmer, he knows how deep he should go, how far he can go. But if
Yes.
a new swimmer, if you ask him, he will have the confidence that I will do,
Yes.
until unless he gets into the problem. These
Yes.
children are in a similar place. They think like they can do it, but
Hmm.
still, till some age, they need parental supervision. If there is
Okay.
no parental supervision, though they might refuse for the parental supervision, it is
Hmm.
our job not to offend them. It is like most of the parents, what they will do, they will start restricting them, that you should not do this, you should listen to me. Because he
Hmm.
is no more a small child, they will have
Hmm.
their hormonal changes, they will have
Yes.
physical changes, they
Yes.
will have.
Yes. Yes.
It's always advised that parents should become their friends in this phase, because
Yes.
it's
Yes.
a difficult
And
phase both
even
for the.
in a Samskrita Subhashita, it is said, once the child grows up and comes to the Yauvana Avastha, he should be treated as a Snehata or a friend. And that's how we know this. The parents, if they don't realize, the child gets, goes away from the parents. Yes,
Yes.
please go
Yes,
ahead.
yes, absolutely. So the parent should become the friend of a child, so that it is a difficult phase for the child himself also,
Also,
because the
yes,
child is going through a lot of changes, physical changes, mental changes. He feels like I was well a year, 1.5 year back. I was listening to them. Now why have become like this? Am I become a bad person? So this is what we give adolescent education to the school children, like seventh standard, eighth standard. When they get these changes, we teach them this, like this is completely normal. In the meanwhile, it is the duty of the parent also to understand these changes and cope with them, so that the child will get some helping hand. Rather than if we put a restriction and if we put a fear in front of them, they might take a wrong direction, they might take a wrong path to put this stress out. So it is always parents' responsibility that they should be like a friend of a child, at least to some extent, so that the child should put up all his stress in front of parent. He should share all his problems.
yeah. So you mean to say that masterly control has to be there, and
Yes.
masterly friendship also must be there, so
Yes.
that they don't go astray. And
Yes.
I request all our viewers, if they have any challenges or problems, they can please ask Dr. Arun Kumar. And also, if there is anything, we can always answer to their questions. Thank you
Yes.
very much, Dr. Arun Kumar, for explaining so well what is puberty and what are the problems and challenges. Thank you very much.
Thank you.
Namaskar. Welcome to Ahara Arogya Adhyatma, the light of Samskara. Today we have Dr. Arun Kumar M.